A shining city on the hill, a pillar of light to those who live in darkness, a miracle to those in need, a place of hope and restoration. Located in Marble Falls, Texas, this volunteer-driven community healthcare clinic and emotional trauma center has in its short existence provided assistance to thousands lacking in health insurance or financial ability to seek medical or emotional help. In short, your community, friends and neighbors. A lifeline of restoration, care and support to those who have nothing. Through the charitable aid of healthcare professionals, community volunteers and generous donations, A Place of Hope is able to provide quality care and encouragement to people who otherwise have no means of getting the help they deserve. Founded by Pat Hancock, recognizing the need to serve people that have fallen through the cracks of our healthcare system, A Place of Hope started as a mission to fulfill a dream of helping those in the community who are in temporary need, and by her persistence and diligence, it has come to fruition. Pat credits the divine hand of her Creator, which led her to the people and the facility that to this day is A Place of Hope.
The Place of Hope has helped me tremendously. Spiritually, physically, mentally. Friends, a lot of them. I love them with all my heart. I don't even volunteer here anymore, and I still come here. It's just not a place of just healing. It's a place of physical being and knowing people loving you and the grace of God. I was down to nothing, and now look at me now. God's a place of hope. I would recommend anybody who wants no longer just as a patient, as a volunteer, as whatever that you may need for a place of hope. I would recommend anyone to come in here and be just affiliated with a place of hope. And like I said, it's a loving, kind place for anybody to be just a part of. Just to know everybody that to help me along the route that I went through. Whether for you all, I probably wouldn't even be here either.
I think it is, the Place of Hope is the place that people can come and feel loved, feel cared for. You know, we help them solve problems and don't solve them for them, but we help them talk through their problems and their issues. And
so during that period of time, I was just broken. I had a broken marriage. I didn't have a job, and I didn't know where to go. So my faith brought me here at the Place of Hope. There was a beacon of light. When I opened the door, when I came in here, there was a beacon of light. Everybody here was so gracious and so helpful. I was diagnosed with high blood pressure. My cholesterol was real high, and during that time, and I felt like I was on the verge of having a stroke and a breakdown. Through the staff here at Place of Hope, I was able to get counseling and help me through a real dark period of my life. It was just wonderful, and right now I'm doing great. So thank you. There's a lot of individuals that are losing their jobs, and they don't have jobs. They don't have where to turn. They don't have families. And here at A Place of Hope, it is family. Coming in here and having a family like you and your staff is advantageous because they don't have anywhere to turn. And you and this is like a tabernacle. It is like a beacon of light. It is. And people just, when they come in here, they know that there's hope. There is a place of hope. And that's all I need to say.
I had a crisis, a major crisis, and I wasn't sure if I was having a heart attack, or I knew it was severe anxiety. I've already gone to emergency rooms before, and I'm still paying the bills after years, for anxiety. Is there any place at all that I can go to? And they mentioned A Place of Hope. There must have been something really special here, because when I walked in the door, I instantly felt safe. I didn't think this was what I was looking for at first, because I thought, this is not an emergency room. This isn't a hospital. Where's the doctor? 3 women, you included, holding me And for me, that was exactly what I needed, not the ER.
I was praying to the Lord for some help for my husband because he was swollen and I couldn't take him in an emergency because we had lost all of our insurance. I told you that he had cancer and that he was not going to be living very much longer, and that I needed help for him just to make him feel a little bit more comfortable. You know, I knew it was coming because, like I said, it was cancer, so I knew it was coming. Just didn't know when. And that's when you guys were checking me out. Because my blood sugar, my diabetes, and my high blood pressure was getting where I was getting really sick. I mean, after the day we had our appointment, hospice was in our house. And even though I knew the Lord, it was hard for me to, I was being selfish at that point. I didn't want him to go. Which I thought it was going to just be, while I was stressed, that I was going to have diabetes and my high blood pressure, but it stayed with me. And that's why I've been here for the last 3 years. Because for whatever reason, the Lord has me with these illnesses. And I had to be strong enough to say that I can still do it. I'm still going to live. So that's what brought me here.
I do the lab work. Right now I'm doing a quality control check on my strep screens. I draw blood from patients, and they really appreciate me because I do have 13 years of experience, and ordinarily I do not hurt when I draw blood. I do believe in a place of hope, as I myself I am a patient. There's people out there that are in dire need, and even with the new insurance program, there's still going to be a minimum of 33% of people without insurance. And so up until I am 65, I need Place of Hope. So that's one of the reasons I volunteer here, is to give back to what they're giving me.
I send out the referrals to other hospitals that we're associated with for laboratory work and radiology work, any specialties that need to be taken care of. Oncology, sleep studies, just whatever the doctors need, another doctor's consult on. There is such a need for a place of hope in this community. So many people don't have any help at all, and this is devastating to them. They don't know where to go, and life just really gets hard on them when they're sick. I'm here because my husband does not have insurance, and he's a client here, and we're just not the kind of people that take without giving a little back. And this is all I have to give is my time.
I have heard mission of Place of Hope, helping people of this community who cannot afford healthcare services, and those people who are emotionally, physically and sexually abused, and Place of Hope is encouraging those people. That impressed me. That's why this way I heard, and I'm here. I'm a nurse practitioner student at Walden University, and I'm doing my preceptorship in Place of Hope.
I was one of a number of volunteer doctors when it opened. We see uninsured, underinsured, and indigent patients, most of whom have some history of mental or physical abuse. There's a trend for a lot more new patients to come on board, partly because other volunteer clinics in other counties are starting to turn them away and serve only their own county population, and partly because Texas leads the nation in uninsured patients, and it gets more so every day.
The Place of Hope to me is an opportunity to do something in the kingdom of God with a cross-section of society that I would not necessarily meet in a formal setting of a church or a club. We're here to help the uninsured and those who have need of medical care, but they also have trauma in their lives. So we try our best to build the whole person, body, soul, and spirit. And it's an absolute awesome feeling when you go home at the end of the day and somebody has said to you, "You really blessed me today. This was wonderful, and I thank God for you." Then I have to say, no, we thank God for you.
There is
so many needs for a place like this, a place of hope. It's just incredible. The need in this world is so great right now. You know, there's so many people out in this world that are in a dark corner where they don't see a way out, or they can't reach out and find even a hand to hold. And this place, the need of this place is tremendous.
I believe that it has helped me realize even more than I already did how people need a place where they can be treated as a whole person and not just medically or spiritually or physically, but as one total person, because that's really what they are.
Place of Hope has helped me. It's helped me get my body back in tune with itself and my mind. It's starting to get me back to that spot where I'm supposed to be, where I was just confused and in pain, and you helped me through a lot of that. Place of Hope has been a godsend.
And the Lord has been so good in so many different ways, and has worked so many different miracles. And God is still working miracles. A lot of people don't understand that and don't believe that, but this is a wonderful, wonderful demonstration of the miraculous power of God. That it's a wonderful opportunity for people to do what the Lord has told us to do. That is to help other people. And we need volunteers, and we need money. And I'm not ashamed to say that. I'm happy to say that. That there are a lot of people that can give, that have money that they can give. And if they do give, they'll find out that it's true. What the Bible says is more blessed to give than to receive. And to give to this place is a wonderful opportunity for people to get a blessing. And I'd like to say to the community, it's a wonderful place, and I believe in it. And I'm willing and I'm ready to say that without any hesitation. God bless the Place of Hope, and may the community rise up and say, we'll help.